expansion with clear aligners is considered as one of the most predictable movements. For example, in this meta-analysis published in 2025, we see that depending on the study, maxillary arch expansion accuracy was from 63 to 88%, excluding second molars for sure. However, it's important to distinguish between expansion by crown tipping versus true bodily movement. The ratio is about 2/3 for tipping and 1/3 for bodily of premolars and first molars. With second molar, it's only tipping. In this study, published in 2025, influence of attachment position and torque correction on arch expansion and aligner treatment, the interesting finding was that control group without attachments showed more bodily movement than the groups with attachments. In this meta-analysis, published in 2026, we can see that average predictability of expansion was 75.5% for maxillary arch and 80.6% for mandible. Mandibular second premolars show the highest pooled predictability, whereas lower second molars were the least reliable. I see similar numbers in most of the studies. In this article published in 2025, we can see that expansion works similar regardless of aligner brand. Angel Aligner, Spark, Invisalign, and other brands, they work similar. What means that plastic material is not that important for successful expansion. And again, the best predictability was obtained in the lower arch for second bicuspids, and the worst accuracy was for canines in the upper arch. And this article, called The Predictability of Transverse Changes in Patients Treated with Clear Aligners, the numbers are similar again. Total accuracy was 64% for lower arch, 67% for the upper arch. But one of the most important conclusions is that the expansion achieved with aligners is mainly due to the tipping of the crown rather than bodily movement of the tooth. The virtual plan overestimates the expansion of the teeth, thus it's reasonable to plan an overcorrection when the arches are highly contracted. Let's discuss how we plan expansion in our virtual setups. First of all, we begin with defining the virtual roots. And in most of the cases, I set these virtual roots regardless of the crown's anatomy, because all I want to get is just buccal tipping, buccal expansion. For example, if we follow the anatomy and we set the virtual axis like this, following the crown's anatomy, our expansion is going to be combined with mesialization, which doesn't make any sense here. Same with this first premolar. If we set the axis following the crown's anatomy, it's going to move not only buccally, but also mesially. We want to move it buccally without any mesial or distal movements. That's why we have to pay attention to this stage of positioning the virtual roots. I add some mild expansion to every crowding case, like this one, and I do it only when we expand the frontal teeth. So at first, we expand first molars, premolars, frontal teeth, because aligners, they will be much more effectively working in the anterior segment if you also add some buccal tipping for posterior teeth. But once you've done with your first stage of round tripping and anterior expansion, you just retrocline the frontal teeth and don't move premolars and molars. Animation on the upper jaw, we expand everything and then retract only the frontal teeth. Again, expansion, round tripping, and retraction. You could notice that I add some palatal tip for second molars, because using this trick allows you to apply more force to the lingual surface of an aligner, and it's going to make your expansion more effective, more powerful. If we take a look at my chart, the limit is 0.25 millimeters or below. We don't need any attachments if we plan tipping, but if you are trying to make bodily movements, you have to add any attachments for retention. And also you can make some compensation by adding buccal root torque. Let me show you. For example, you want to achieve as much bodily buccal movement as you can. Of course, you don't move the premolar with these arrows, because it also moves it in the vertical plane. Look, it goes up and down. No, we make bodily expansion instead. We do it like this. And then you should add some buccal root torque by tipping the crown back palatally. And of course, you need to add some attachment here, either elliptical or rectangular or with any similar shape. If you want to move premolars or molars palatally, you just tip it. Or if you want to do it with bodily movements, but I don't know if there are many clinical situations when you might want that. I cannot even imagine why you would want to move the premolars in that way, but I would just bond the attachment to the oral surface of this tooth, and use the opposite logic to the one we use for expansion. With first molars, the principles are the same. You need an attachment if you want to try to move it with pure translation, not only tipping, but the chances are much lower, because if you compare the anatomy of the roots, you understand that the chances for bodily translational movements are very, very low. That's why I never plan bodily movements for second molars. Never ever. A aligner just cannot produce enough force to move the crown and the root of the second molars for the same distance. No, it's even very limited with tipping. That's why I almost never expand second molars with aligners. I think the chances that you can do it with the very edge of your aligner are very low, but you can try. No one will blame you for that. Let's take a look at a few clinical cases where we expanded molars and premolars. We create some space and we tip the premolars buccally, but if you take a look at the occlusal photo, you can clearly see that it's not enough to just push with an aligner. You will definitely need to support this expansion with auxiliaries. For example, as we did in this case, we bond buttons and patient is wearing elastics to try to preserve these contacts. One more example of expansion. Here we're using the same technique. We're moving the second molars palatally while expanding the first molars and the premolars. Of course, this movement is achieved mainly by tipping and again with bond buttons to retain this expansion. Another clinical example, expanding the dental arches, very noticeable changes. But if we don't retain this expansion by using auxiliaries, we can expect a massive relapse. Another case where we also expanded the premolars and first molars, but here you see that again the contacts are not tight because crowns they tipped buccally. It's not a big deal to do that. As we already know, it's a very predictable movement for aligners. But the main problem is in maintaining this expansion. That is why you should prescribe elastics after you bond fixed retainers. And the last example for this video, expansion made primarily by tipping. Looks good, right? But when we take a look at the contacts, we see that if we don't do anything to maintain this expansion, we're going to get a quick relapse once we remove the aligners. Again, I recommend you to do some light expansion in all the crowding cases. Of course, if there are no implants, if you can move all the teeth, just do it because it will help you to obtain more space and also to facilitate the movements of anterior teeth when you expand and rotate them. Thank you for watching. See you in next videos.